So today I'm going to be talking about palliative care. On our introduction here, it says palliative care is about providing maintenance measures to patients with terminal illnesses and trying to keep them alive as comfortable as possible. So knowing that cancer patients, like I am one of them here, we know to say treatment sometimes can fail, and if treatment fails, we undergo palliative care, which helps us to relieve pain and keep us alive for a long time. Yeah. The principles of palliative care. The first principle is pain relief. This ensures that the client experiences death free of avoidable pain and suffering, and in accordance with the client's and family's issues. So here on pain relief, what they're trying to explain is to say, people with cancer, we experience pain, and for us to relieve that pain, when we're at the hospitals or maybe we're being seen at home, medical personnel make sure that we die peacefully without pain. So they make sure they give us diversional therapy, let us stay with our families for a long time so that we may not experience that pain and suffering. Yeah, and the second point is support. This ensures availability of support for the client to enable them carry out activities and enjoy doing that, improve and quality of their life. So like as I'm doing right now, this is a cancer support group. It's my channel which I've created, which is only a day old. So I'm supporting my fellow cancer patients to stand firm so that it's part of diversion of therapy which will help us avoid pain and to suffer less. Yes. And I have a video which I recorded. She's a palliative nurse from England. She came to our country Zambia, specifically at the University Teaching Hospital, which is the highest hospital in Zambia, which is located in Lusaka, and she talked more about palliative care. Hope you enjoy the video.
My name is Faye McDowell. I'm a palliative care clinical nurse specialist from Mid-Essex Hospital Trust, Broomfield Hospital, Essex, England. I'm doing this teaching in conjunction with the University Teaching Hospital Lusaka, where I visited earlier this year and made relationships with Charity, your palliative care nurse, and the nurses from the Cancer Diseases Hospital. I hope you enjoy. This slide is a poster designed by the Our Hospital Palliative Care team for a hospital competition. This is the NHS Choice definition of end of life and palliative care. Please take a minute to read the definition. This poster was designed to demonstrate the 5 domains of holistic assessment: physical, social, psychological, environmental and spiritual. How would you holistically assess? This case study is based on a real patient. We ask you to consider that you are this patient in order to put yourself in their shoes. You are a 45-year-old lady married with 2 sons who are 13 and 17. The following points tell us about the treatment that you have had and how your disease has progressed. It also looks about how your life is now and how much it has changed and how this affects your family and yourself. We then ask you to think of 4 questions. If you are thinking of yourself as this patient, what might you be thinking? What might your priorities be? What might your family be concerned about? How can healthcare professionals support you and your family? We have made a list of answers to the following questions as part of a group, and from those answers found that there was clear demonstration of the complexities which can arise from one patient. Here we have a brief introduction to communication skills and breaking bad news. If you are in a group, you could try playing the game Chinese Whispers to demonstrate how easy it is to mishear or misunderstand something. You start by whispering a small phrase to one person, and this person then turns to the person next to them and whispers the phrase, and then the last person in the chain will tell you what they've heard. What skills are needed for good communication? These are some of the skills we believe need to be considered when preparing to communicate well. Empathy, active listening and body language. Think about your tone of voice. Establish a relationship of honesty and trust, and make sure you use appropriate vocabulary, avoiding jargon. This slide makes you understand that verbal communication is only a small part of total communication, with non-verbal and the tone of voice being the most important parts. We performed an exercise where in pairs we talked about a recent family gathering. Some of the recipients of the information acted enthused and some bored, and then we thought about how this made us feel when delivering and receiving this news. These are some of the barriers to communication. Take a moment to have a look at them. As you can see, they are very similar for the patient and carer and healthcare professionals alike. Knowing these skills and barriers to communication can help us when breaking bad news. Breaking bad news. The first clip is a useful aid to follow for breaking bad news. The second is an example of breaking bad news well.
Whether it's something you do every day or once in a blue moon, delivering bad news is never easy. Here are 5 scenarios, each depicting one of 5 steps in the process of giving bad news. Following this process will help you deliver the news, help you to look after the person who is going to get it, and look after yourself too. So, what is bad news? Obviously this is subjective. What is bad news to one person may be good news to another. Really, the only person who can decide if it's bad is the receiver. Step 1 is about preparing. Take a few minutes to gather your thoughts before you have to break the news. Breathe. Find a quiet, private space, somewhere you won't be interrupted. It's a good idea to have a colleague with you, someone who can be there as an extra support to you and to the person getting the news. Make sure you know all of the relevant facts and have all the relevant information to hand. For example, recent history, test results, treatment options, etc. The second step is about person-to-person connection and human kindness. Take a bit of time. It's really important to make a personal connection here. Tell them your name if they don't already know it. Sit down with the person. It's easier to break bad news if you're building on what the person already knows or suspects. So begin by asking them what they know. For example, with a person who's had some tests, tell me, what do you know about the tests you've been having? Then, step 3 is about actually breaking the news. Start by giving a warning shot to allow the person to prepare themselves. Yes, your test results have come back, and I'm sorry, but the news isn't as good as we'd like. Avoid jargon. Break the news gently and slowly, using simple and clear language. For example, I'm sorry to have to tell you that it looks like you are in the early stages of dementia. Bad news can feel like a stomach punch. People who are shocked cannot take in a lot at a time. So break the news into chunks, making regular checks for understanding. If they are silent, remember this doesn't necessarily mean that they have absorbed or comprehended all that you've said to them. Check again and repeat anything that hasn't been understood. The fourth step is about dealing with the person's concerns. Give the person time to take the news in and to respond. Don't be tempted to fill the silences or to rush ahead with further details. Give them time to voice their concerns before you start giving them practical details. Wait. Wait. Check and listen. Acknowledge the shock. I'm sure you weren't expecting to get this news today. It must be a terrible shock for you. Wait. Let them respond. Repeat the news one last time. It's unlikely they will have grasped everything. So, just for clarity, let me tell you again what we know about this. The fifth and final step is about follow-through. When they're ready, tell them what you have organised for them, what happens next, and what support is available. Even if the news is really bad, leave the person with some hope. You could say something like, there are different options available to help manage your symptoms and help you live your life as fully as possible. We can talk about these more when you've had a chance to take in what I've told you. Just remember, you can never make bad news good, but the way you deliver it can have a huge impact. Finally, don't forget to look after yourself. This was probably quite difficult for you too. Make sure to take a few minutes and to debrief with your colleague. These steps are just a few simple reminders to help you to deliver bad news on the hopefully rare occasions when you have to. You can download a free print copy of these 5 steps from the Irish Hospice Foundation's website. You can also find details there of education and other resources on a range of issues relating to bereavement and end-of-life care.
Okay, so that was just a simple briefing that I had that I wanted to share with you, my viewers, and I will be giving you each and every day. I'll be giving one video about cancer. So tomorrow I'm going to give about exercises that cancer patients can do. It's been nice for you to listen to this video, and I'm glad that you've paid for it.